Did you know that over half of Americans now face a silent health crisis? New blood pressure guidelines have redefined what it means to have hypertension, potentially impacting millions. This shift isn't just a number game. It's a critical update that could change how we manage this leading cause of heart disease, stroke, and dementia. But here's where it gets tricky. The new standards may seem more strict, yet they're designed to catch issues earlier. And this is the part most people miss: how small changes in daily habits can make a big difference. Hypertension, often called the silent killer, affects nearly half of all adults in the U.S. https://highbloodpressure-data/research/facts/stats-index.html. It's not just a number on a scale. It's a ticking time bomb for heart attacks, strokes, and even cognitive decline. Yet only a quarter of those with high blood pressure actually have it under control. This gap between diagnosis and management highlights why the new guidelines matter so much. In August 2025, the American Heart Association and American College of Cardiology released updated rules for hypertension. These guidelines, based on a decade of research, aim to help doctors and patients work together to prevent serious health outcomes. Dr. William Cornwell, a cardiologist from the University of Colorado Anschutz Medical Campus, explains how these changes could reshape care. Let's break it down. The big shift in definitions. The new guidelines lower the threshold for what counts as hypertension. Previously, prehypertension was a category for those with readings between 120 to 139, 80 to 89. Now, that's split into two groups: elevated, 120 to 129, less than 80, and stage 1 hypertension, 130 to 139, 80 to 89. A reading of 140 per 90 or higher is stage 2, and 180 to 120 is a medical emergency. This change means more people will be classified as having hypertension, pushing the need for early intervention. Why this matters? The stakes are high. Hypertension is the top risk factor for heart disease and stroke, and it's also linked to dementia. With heart disease, stroke, and dementia being the first, fourth, and sixth leading causes of death in the U.S., controlling blood pressure is crucial. But here's where it gets controversial. Some argue that lowering the threshold may lead to overdiagnosis, while others say it's a necessary step to catch problems before they escalate. Lifestyle changes are key. The guidelines emphasize that managing blood pressure isn't just about medication. Lifestyle factors like diet, exercise, and alcohol intake play a major role. For example, alcohol increases blood pressure by about 1 millimeter hectare per 10 grams consumed. A standard beer has around 14 grams, so regular drinking can raise blood pressure significantly. Studies show that cutting back on alcohol, especially for those who drink excessively, can lower blood pressure quickly. Diet and exercise. The DASH diet. The DASH, Dietary Approaches to Stop Hypertension diet, is highlighted as a powerful tool. It focuses on fruits, vegetables, low-fat dairy, and whole grains, while limiting salt. The average American consumes over 3,300 milligrams of salt daily, far exceeding the recommended 2,300 milligrams. Even smaller reductions, like using potassium-based salt substitutes, can help. Regular exercise also matters. Every 30 minutes of aerobic activity lowers blood pressure by 2 millimeters of mercury systolic and 1 millimeter of mercury diastolic. Aim for 150 minutes a week for maximum benefit. Personalized care with the Prevent tool. A new risk calculator called Prevent helps doctors tailor treatment. It considers factors like age, cholesterol, medical history, and blood pressure to assess cardiovascular risk. This tool is free online and could revolutionize how care is personalized. For people with multiple chronic conditions, like diabetes or obesity, it's especially valuable. But here's a thought: Should the criteria be adjusted to better reflect individual health profiles? What do you think? Final takeaways. The new guidelines push for more aggressive treatment, home blood pressure monitoring, and a focus on lifestyle changes. By working closely with doctors, patients can take control of their health. After all, hypertension is a silent threat, but with the right approach, it's manageable. What do you think? Should the criteria be adjusted to better reflect individual health profiles? Share your thoughts in the comments below.